The United States spends far more per person and overall on health care than any other country in the world. We spent about $2.6 trillion this year alone on health care. The Bipartisan Policy Center, which is a think tank in Washington, D.C., recently looked at that spending, and they said, what are the factors driving that spending? And they came up with this report that listed 15 different factors that are driving spending. Now, they didn't rank these in any particular order, they just laid them out. But if you look at the study and you look at other studies on healthcare costs, three big themes emerge. So one big factor driving healthcare spending is how we pay for medical services. Most insurers and Medicare pay doctors, hospitals, and other medical providers on what's called a fee-for-service basis, meaning they pay for every test or procedure or office visit. Now, this can be a good thing because it does reimburse for needed services, but this report says it can also reward unnecessary care or overtreatment. When you take that payment method and you add it on top of a medical system that's really not that integrated, you can really add to the difficulty, you can add to spending, you can get repetitive tests. How often has it been that you've gone from one doctor to another and you found that your test results haven't followed you to that doctor? So the doctor says, well, let's just run those tests again. So it's this kind of thing that can drive up spending. There are many reasons why people either want or need more medical care, and this factors into rising spending. First of all, we've got a lot of new drugs and treatments, things that we didn't have 20, 30, even 10 years ago. No one's saying we need to go back to 1960s medicine, but a lot of these newer treatments are more expensive than the older treatments they replace. Still, doctors and patients want them, and they come on the market even though there may not be sufficient proof that they're any better than the older, less expensive medicines. Secondly, there's a lot more demand because as a population, we're getting older. Lots of baby boomers are heading into the retirement years. That's going to put more pressure on spending. And we're also sicker in many ways. About half the population is estimated to have some kind of chronic illness, such as asthma or diabetes or heart conditions, which can drive up their use of medical care. And finally, about 2/3 of Americans are either overweight or obese, and that puts them more at risk of having these kinds of chronic illnesses that then, in turn, drive up spending. What we spend on healthcare often depends on what our local market looks like. Your local hospital, for example, may not be just a hospital. It's more likely part of a bigger system that includes other hospitals, even clinics, doctor practices. It's making it a larger entity. Now, this can be a good thing because it can result in more efficiency, but this report and others have said that such consolidation can create sort of near monopolies that can drive prices. And that's what we're talking about here. The ability of doctors and hospitals and other providers to raise their prices really affects how much we spend on healthcare in this country. So if you have a near monopoly, it makes it easier for them to drive higher prices. And this report says that until we can slow those rising prices, which generally have tended to rise far faster than regular inflation, we're never going to get a handle on overall healthcare spending. So this market consolidation is being looked at as quite a big factor in rising healthcare costs.